Hi, everyone. I'm Sandra Levy. I'm Senior Editor of Drugstore News. Today, we have Dr. Chris Jagmin. He's Aetna's Chief Medical Officer for Medicaid. Welcome, Dr. Jagmin, and thank you for joining us.
Thank you for having me. I'd love to be here.
Oh, it's my pleasure. So let's get started. Aetna Medicaid, a CVS health company, recently announced a big collaboration with the National Alliance for Care at Home and the Mission Care Collective. The idea is to improve access to home health and to support direct care workers in Illinois, Louisiana, and North Carolina. So can you tell us what factors led Aetna to pilot this effort?
Well, think about it. We're all living longer, but we're not necessarily living better. So we're not dying from acute diseases, but we have chronic issues. We have joint replacements. We have heart failure. We have diabetes. So increasingly, we're spending more and more time at home. And we don't always have the support we need to have our daily activities. And so it's critically important that we have access to a good supply of people who are dedicated to help us as we age in place.
So what role will each organization play in helping the home care patients and older adults with disabilities to get the care that they need?
So I think from the health plan viewpoint, we identify the members, the patients who would benefit from this. We have the providers that are coming through the alliance, as represented there, who actually would direct the services and in some cases deliver other services. But how do they hire and retain those direct healthcare workers? So the third party here, the collective here, has come up with a set of tools to engage employees who are in these roles, to keep them more satisfied, to keep them better trained, and to help them in performing their job. So this helps the providers who are utilizing them to attract them to the job, to train them in the job, to retain them in the job, and to give them skill sets and a social network to connect to want to stay in this role.
So with the shortage of healthcare workers, they also have problems, many of them, as far as health, their own health and their own financial problems. So how does this collaboration help?
Well, think about it. 32% of the direct aid workers are themselves on Medicaid. So they have their own challenges of getting to work. They have their own challenges of how many hours they can work. So if we can help identify and support those needs through the collective and give the providers a tool to say, oh, these are the things that we need to do to help this particular worker. These are the things we need to watch out for. This person might not be happy in their job or might need more aid. That kind of directed insight helps very busy providers to say, okay, now I know who I need to focus on. You've given me a task. I don't have to wake up every day worrying about my entire employed population.
So what is the role of pharmacy, or is there a role of pharmacy in making care work at home?
So people interact with the pharmacist far more times than they do with the physician during the year. And increasingly, that means medicines are being delivered to the home, either same day or single day. And not only that, but you can also batch prescriptions and batch medications. Many of us are on multiple drugs as we age, and to get those all at one time in a convenient way, to be able to reach out to the pharmacist to ask questions, we can do that either telephonically or oftentimes even by protected email communications, or even in some cases virtually.
Excellent. Can you tell me, why did you decide Illinois, Louisiana, and North Carolina as the pilot states?
So these are states where needs were identified, and why those particular states? So the state governments themselves often come to us and say, look, you've done a great job of building out physician networks. You're helping us with physical therapists, with things like that. But what can you do for us in these alternative delivery models with direct healthcare aids, for instance? And so we as a company come back and say, okay, we want to be good partners to the states. So let's look around. Oh, well, guess what? There's a national organization that helps represent these folks and deliver care. Oh, and here is a third-party solution that can help these providers. So for us, it was kind of natural. You'll notice in some of the press release that the groups that are we're aligning with are in all 3 states in some cases. So it was kind of a natural fit for a pilot.
Oh, that's exciting. Can you tell me a little bit more about the National Alliance for Care and the Mission Care Collective?
Yeah, the National Alliance for Care represents all sorts of home care folks. So think about anywhere from nurses to therapists to pharmacists delivering services to infusion folks. So they kind of an overall arching organization to help represent those folks both in their development as well as advocacy for coverage for their services. Now, the collective itself is really mission driven to try and help workers in their roles, to understanding that between 2021 and 2031, it's expected there will be a need for 1 million more direct care workers. So this is an opportunity for organizations to train and find these folks and support them. I think it's a great 3-pronged opportunity here.
Yeah, it sounds wonderful. So speaking of that, will you expand the pilot at all?
We hope to. The first year, we essentially put up the money, the $250,000 for the first year, and it's payer agnostic. So it doesn't matter. They don't need to be an Aetna member, don't need to be a Medicaid member. It's whatever membership that the providers and we deem necessary or appropriate. And then we're going to track and follow it. And we're going to see, are we retaining employees better than we were before? Are the employees happier? And so we'll track those measures over the course of a year. We'll also ask patients and members, is this working? Are you getting the care you need? And we'll compare the 2 groups. We'll compare groups who've received this intervention and groups who haven't. At the end of the year, hopefully we'll be able to find success and continue the program.
Oh, that's excellent. So that leads me to my last question. What is the future of the home healthcare industry and market today, as you see it?
Oh, it's booming. It's going to grow. It's going to grow think about all the baby boomers who are now retiring, and I find myself somewhat in that capacity now. Mm-hmm. So we're going to need, in theory, I've got 20 more years to live, right? So a lot of us are out there, and we're going to need care as we age. Most people, 95% of people want to age in place. They do not want to go into facility. They do not want to go into assisted care, but they're going to need care in the home. I have an 86-year-old mother-in-law who gets 2 hours a day from a direct care aide, and I don't know what we would do without her.
Well, that's excellent that you're doing something about it. And I hope you'll come back. It was wonderful that you shared your thoughts and insights, and I hope you'll come back and share some of the results after you get them.
Great. Well, we'll see you in a year.
Terrific. I look forward to it. Thank you again. I appreciate it.
Thank you.